Hey, this is Dr. J. Welcome to our blog, A Daily Dose of Vitamin H. I'm really excited to tell you about one of our amazing clinical outcomes and a good friend of mine, more than a patient, because when you have someone that comes from so far away and has such a life-changing experience, it's just really, really neat. So this is Holly. Holly is from the booming megatropolis somewhere back in Massachusetts.
Salisbury, Mass.
Salisbury, Mass. And I asked her to come on our program today. Holly, what we're trying to do with this is to put some good news out into the universe, the internet. So that's why we call it a daily dose of vitamin H. Vitamin H is not a real vitamin. It stands for vitamin hope. And so we're just winding up 2 weeks of treatment with Holly. But Holly, tell us what it was like when you first came in.
When I first came in, I was very, very sick. I was using a walker, and I had no energy. I was sleeping 9-10 hours a day. I was gray. I couldn't do anything. I had no life, basically.
And you were on a ton of meds.
Ton of meds. Yeah, and I also had IV antibiotics for a year, which did nothing. And
so, Holly, your official diagnosis was?
Lyme's disease.
Okay, so chronic Lyme disease.
Yeah, chronic Lyme.
You came out in April.
Yes.
And spent some time with us. It was really cool. We're going to show the clip of what happened after April when you went home. It was one of the best things I've ever seen. So it was Holly getting out the basically coming in the airport and then going to see her husband, who I got to meet this trip.
Yeah.
And so that was really cool. And then you went home. How much improved from April?
I went home about 50% better, and I came in 0. So I was very happy. I had my life back, and pretty much for a good 3-4 months, and then I started to dip a little bit, so I came back here for more treatment.
So we came back, we're just finishing up 2 weeks, and how do you feel now?
75% better.
So awesome. And how long were you sick? It's been more than a year.
I've been in bed for 8 years. 8
years. So we took someone from 8 years to pretty good health. It's been just amazing, both on our side and on Holly's side. So Holly, what treatments did we do?
UVL, which is a new treatment, which I felt a lot of energy after I had that done.
So that's a special light treatment that we do at the office. That's a new medical study that we've done. We've seen amazing outcomes. What else did we do?
Neurotherapy.
So that's reprogramming the nervous system. It's a kind of an advanced acupuncture technique that our nurse practitioner or medical doctor do, where they do these little tiny injections of B vitamins into acupuncture and nerve control points.
Yeah, and I had vitamin C IV bags and minerals.
And so the vitamin C, just amazing, really fairly high doses, anywhere between 50 and 100 grams of vitamin C. And so we were rotating those treatments. And then we also did some mind-body healing and some detoxing and some nutritional supplements. So it's a comprehensive approach, but just an amazing to see how far you've come.
Very far.
So,
love this guy.
So Holly, if someone was watching the video with chronic Lyme or chronic infection, would you tell them to come in?
Absolutely. This is the best place in the whole United States to come. You shouldn't be doing anything else but this type of treatment. I've done everything. This works.
And is it okay to put on social media?
Absolutely.
All right. So you guys, this is Dr. J getting ready to sign out. Check out our blog of Daily Dose of Vitamin H and our website for an amazing clinical outcomes. We're so excited for Holly to go back to Salisbury,
Mass.
Salisbury, Mass.
Yep.
And it's been fantastic to be part of this experience. Check us out periodically. This is Dr. J and Holly signing out.